Education and Health Subcommittee on Health will convene and come to order. Call the roll.
Senator Sasla.
All right, he's here.
Senator Barker.
Aye.
Senator Dunavant.
Here.
Senator Suderline.
Yes.
Senator Lewis.
I am here.
Mr. Chair, you have a quorum.
Great. First up on the sign-up sheet, we have Delegate Coiners 229. Delegate Coiner. We'll get you out of here.
Good afternoon, Mr. Chair.
Good afternoon.
I do have an amendment in the nature of a substitute.
All right.
Mr. Chair.
Distribute that. And
I'll move that.
I was going to say Senator Suderline and seconded. So all in favor of adopting the substitute? Aye. Substitute's in front of us.
Thank you, Mr. Chair. So I'll explain the underlying bill and then the substitute along with it. So the purpose of our bill, the Virginia Department of Health has had a practice of collecting information related to the social determinants of health. And that information is relied upon by many of our hospital systems, by our nonprofits when they're trying to obtain grants in order to help improve the health outcomes for residents and communities. And so our bill makes it where that practice would not end if perhaps staffing became an issue, that this is something that would continue to be collected because it's so important for our communities. And it also added that they would report it based on demographic data so that we could see by race and gender and age that information. The purpose of the substitute, we added in that demographic information as an amendment and didn't quite get that language right so that it wouldn't result in a fiscal impact and some additional analysis that they're not currently doing. So our substitute ensures that the data that's being collected would be analyzed and provided along with demographics as they were able to do without additional reports being generated. I'd be happy to answer any questions.
Senator Sasslaw.
Give me an example of what you're trying to do.
So one of the things that we look at in terms of a community is their access to health care. And so that's one of the issues that could be impactful. We're able to analyze also looking at access to transportation, education. All of those are social determinants of health. And then we're able to analyze if it's being more impactful with different race, gender, neighborhoods where folks live. It allows us, a lot of our nonprofits, a lot of our health departments are able to use that information to go in and provide more supports in certain areas of our state. And so the information is really useful. We want to ensure that that practice never stops because it's become such a key component for how so many of our hospital systems, nonprofits, and really our own health departments are able to see where we have improvements to make. We, of course, have different communities that have different levels of overall health, and our goal is to ensure that everyone's health is improving. So that's the reason for the bill.
Any other questions from the subcommittee? All right. Are there people here to speak in favor of this bill which passed the House 99-0?
Give them about a half minute.
Thumbs up.
That's all we need. It's a good bill.
Good afternoon, Mr. Chairman and members of the subcommittee.
You're not going to read that whole thing.
No, it'll be short. It'll be quick.
The train is pulling out of the station, so.
It'll be quick. I've been working with Delegate Coiner on HB 229. I'm a law student at the University of Virginia with the State and Local Government Policy Clinic. The views I express are my own and not those of the school. HB 229 is important because in mandating the collection and reporting of this kind of data, it allows local governments to receive the information they need to address negative health outcomes in their populations. It's also particularly important to struggling communities who might not have the capacity to do this collection on their own. So for those reasons, I urge you to support HB 229.
Oh, great. Okay, thank you.
Thank you for your time.
Next.
Mine's even shorter.
Good. We've got a long docket.
Becky Bowers, I'm here with the Virginia Public Health Association, and we are in support of this bill.
Great.
Thank you.
Davis Gammon with the Virginia Hospital and Healthcare Association, and we support the bill.
Great.
I'll move that we recommend to the full committee reporting.
Moved and seconded that we recommend to the committee reporting House Bill 229 has amendment in the nature of a substitute. Clerk, will you call the roll?
Senator Sasla. Senator Barker.
Aye.
Senator Dunavant.
Aye.
Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Thank you, Mr. Chair.
Thank you. All right. Delegate Byron.
Thank you, Mr. Chairman, members of the committee. My bill is House Bill 156. This bill is very similar to a bill that passed out of the Senate from Senator Peake. And I noticed that some of what I intended to do with the bill was not clarified in the language that I had, and I was going to request, I had given a copy to legislative staff to possibly amend mine to be like Senator Peake's, where it leaves out family life education. I did not, that was not the intent of the bill, to interfere with any communication that regarded family life education and some of those kind of materials that they share with school nurses, physicians, or such.
So do you want to try and do that on the fly, or do you want it to go by for a week?
I would like to try and do it. We have a copy on the fly since you already saw it before, and then I can at least explain what the bill was instead of, it won't take that long.
Okay.
So if any of you recall, there was a program that the Virginia Department of Health had third party with the birds and the bees. And many of us were very upset and shocked with that because parents were not involved in it, and there was mailings that went out to minors about information.
That's the text program?
That was the text program. So I was surprised when I continued to check on that and saw that while they stopped doing the mailing, they actually, their website directed you to 3 different places where you could obtain the same thing. And they didn't say they stopped it because it wasn't, something they should have been doing, or that it wasn't something that, parents shouldn't be involved in. They said it was because it wasn't cost effective. So on the site, it directed you to 3 different places. RU, which is operated by Planned Parenthood. There was another one called Scarletine, which I brought a few copies of the site so I don't have to say any of these things out loud in the presence of people in this room. But that information and many more pages is what Scarletine tells the children when they get on that site. And
Is this still on the?
As of 24 hours ago, the acting commissioner took it down for me. So, but that has been on there for quite some time. And so Scarletine was there, and they had a lot of inflammatory information in my mind that parents should be discussing with their own children, and not the state government promoting. And there was nothing there from other groups that just focused on the family or anybody else. That sincerely was not the point. If we're going to get into some of this information, that should be done through curriculum that is agreed upon through the Department of Education and delivered to our kids in school. So that's the kind of information, yes, that was coming from the website. And then there was another site that was operated by teens, and you could text or call phone numbers and talk to various people that were promoting those. And that was on the site. And this bill is intended to not only stop things like that, but to there's another program that they're getting involved in that I just think that this ought to be done through family life education, and that this bill will help stop those things.
What was the name of that other website you said it directed them to?
RU. It's a bot that answers questions. Scarletine, those sites are still up there, but it's ROO. It's RU. And then there's one that's specifically for teens. Scarletine had about a couple hundred different clicks. You could go on to various things, but the most offensive book that was there was that one that is titled Pussypedia, and the one that had to do with abortions, and it was very offensive.
Mr. Chairman, have we made
Yep.
an amendment?
That was my next question. I don't think we have. I think
Okay.
Delegate Byron has given us what she wants to do in concept, but I don't know if we can.
Council
That's
tell us
why.
what it is,
Well,
yeah.
that's why I asked if we wanted to do it on the fly.
This
or
was
try and do it
the-
next week. So.
This was
Well,
Senator
let's
Peake's
go
bill.
by For a week.
Look, I voted for the Peak bill.
It's not going to
So,
endanger it. I just wanted to.
Yeah, so if this is a substitute, I move the substitute.
I'll second it.
Want to go with that? Okay.
Let's see, let me see it.
Sure.
You want to take time to look at it for a minute? Before we get into questions?
And I did discuss this with the Department of Health, the acting commissioner now, and someone from Northern Virginia that asked that I amend it to this. That would.
My other concern is, I think we're going to get some testimony on this, and I'm afraid people are going to be speaking to the underlying bill and not having seen this thing is another concern that I have. But let's see.
But do you adopt substitutes in the sub?
We have to get in front of the subcommittee, yeah.
Mr. Chair,
Senator Barker.
question
Yes.
for the patron. Am I correct in guessing that the language here in the substitute would address the situation that we have in Fairfax County where the health department nurses are the ones who are in the schools? And has that...
gentleman that came to see me was going to be in your committee, and he said it did. Yes.
So, Mr. Chairman, so I'm Claudia Arthur of Fairfax County. I believe my counterpart at Fairfax County Public Schools spoke with you. And so we have not seen the substitute, but yes.
He
that's
gave me the substitute.
Okay, so I think we talked to you about Senator Pete's bill from
Yes,
last year,
that's what
which
it is.
exempts education altogether.
Yes.
I both voted no on Pete's bill.
Our concern,
Yeah.
although I haven't laid eyes on it, but my understanding is that's what the bill from last
So
year.
what did Pete
And
say?
I don't believe Senator Peake probably had all the information that I had that was being promoted from the Virginia Department of Health site as well. And
We amended his bill on the floor, I believe.
I didn't vote for Pete's bill.
No, you didn't.
you might
I'm not sure we got it.
you might want to vote for
Are you
this
sure,
one.
Saslaw? Are you sure you didn't vote for that?
I'm pretty sure he did. So what have we got? What is this substitute that we've adopted, or it's been moved that we adopt?
Mr. Chair, this is the version that passed out of the Senate 20 to 19 last year.
Okay, okay.
If you'd like, I can read it out loud. It's short enough, that way everyone knows what it is. Or not.
Yeah, go ahead, give it a try.
Okay.
It's better than not having it at all.
Sure. Except as otherwise required by law, no person employed by the department or a local department of health, or who has entered into a contract to provide services on behalf of the department or a local department of health, shall initiate communication regarding matters set forth in subsection B of section 22.1-207.1 with a minor on behalf of the department or local department of health without the consent of the minor's parent or guardian or person serving in loco parentis. This provision shall not apply to school nurses, physicians, or Virginia Department of Health employees or agents who are inquiring about medical conditions, outbreaks, pandemics, or any other declared state of emergency relating to a communicable disease or public health threat.
Can I have that? Okay. Are there any questions from the subcommittee? Because the first person I'm going to bring up is Department of Health. So has anybody got any questions for Delegate Byron or?
No, sir.
All right. Anybody here? Who's here from the Department of Health? You
I'm Director of the Office of Family Health Services at Department of Health.
You drew the short straw today, did you?
No
Okay.
problem.
All right. Go ahead.
So I have not yet seen the substitute. I am familiar with the language.
This is Senator Peake's
Right.
version.
And so the subsection B that's referenced here and speaks directly to family life also includes language related to sexual assault and mental health. And so this would impair our ability to initiate communication with minors about sexual assault and mental health. VDH is the code-mandated agency on youth suicide prevention.
Isn't that covered in code under 54.2 something where a minor is considered emancipated for consenting for that service if it's regarding mental health or reproductive rights or any of, so that's already covered in the exception that's made for as otherwise provided in the code?
I believe the treatment, you are correct, the treatment for sexual assault is, but our education related to that would be impaired.
All right. Look, here's what I'm going to suggest. Okay, I voted for the Peake bill. I know where you're going. I, in concept, support where you're going. If you make me vote today, I'm not going to vote your way. So I'll give you the opportunity to go by one more week and get something firm in paper for everybody, all these folks to see, or we can roll the dice today. It's up to you.
No, I'd rather have a bill that is the way you want it, so I'm not trying to rush it.
Okay.
I know our time is going to get limited with all our
I have got commitments.
I know, I
We're
understand.
by for the week.
I understand.
That's right.
Yeah. I mean, like I said, I know where you're going, so.
Okay.
Okay.
Thank
All
you
right.
very much.
Bye for the week. Delegate Hodges. I hope you're going to offer as much excitement as that last one did.
Mr. Chairman, I'm here to talk about something very, very exciting. Septic, unless you want me to say it in some other terms, Mr. Chairman. No,
No.
better not.
No.
They said it on the House side, but it's, yeah, it means.
Kathy wouldn't let you use that terminology.
But thank you, Mr. Chairman. There is a technical amendment, I believe. It's just some wordsmithing. There were some extra words, if you don't mind, Mr. Chairman.
Senator Saslaw and moves and Senator Donovan seconds that we adopt the amendment. All in favor? Aye. Amendment's in front, bill is amended is in front of us.
Thank you, Mr. Chairman. They were just some extra words that were missed in the original bill, so it doesn't change the bill. But backing up a couple of years, I introduced a bill dealing with failed septic systems in the rural coastal region, and it's not something really to be proud of, but in the Middle Peninsula, we're the failed septic system capital on the East Coast, dealing with a tremendous number of issues. And it actually is in the rural coastal region, Middle Peninsula, Northern Neck, and Eastern Shore, close to the bay. It's not the best thing for water quality and for the environment and trying to reach our WIP goals. We're only at 12.6% compliance right now, and it's up to the Commonwealth's attorneys to oversee that. Of course, Commonwealth's attorneys don't want to take grandma to jail, and oversight's a tremendous issue. Out of that study and looking at this turns it over to VDH to do a pilot program to oversee compliance in the rural coastal region. It really, and one thing I was adamant about was to do outreach and education to get folks into compliance with which I believe is very important, and to report back. And this is very important. If we can double our compliance, we'll make a tremendous, as far as reaching our WIP goals. And so I think it's a big issue, and it's a good pilot program. So that's pretty much the bill in the simple version. I can get into the details if you would like, but I don't think y'all want to talk about that today.
No.
But that's pretty much it.
Mr. Chairman, question.
Senator Donovan,
Is the amendment changing it to a study?
It does not. It was just, there were some extra words in the amendment.
Is there fiscal impact?
There is a fiscal impact. So it was in the introduced budget and the current
Okay.
administration also.
Covered
I
in
know
the
it was in the
budget.
House and the Senate budget as well. So it was included, and it was a priority of the current administration.
Senator
as well.
Saslaw.
Yeah, you have on there the pump outs that are managed by the department. Does this all go to one place? Is that?
Well, they would.
You're not talking about individual home pump outs, are you?
These are individual home pump outs. So where we live,
Well, how does
there's
the department manage that?
The department will oversee that. Right now, it's up to, if you don't mind, Mr. Chairman, the localities oversee pump out, enforce it, monitor that, know who's. And I mean, right now, it's very difficult for the department to even know where many of these septic systems even exist.
Okay.
So we're dealing with failed septic systems, contaminated shellfish waters, and it's a lot of issues, a lot of problems. And it would give the department the ability to oversee this.
Right.
And ensure compliance in a meaningful way. And it actually changes it right now in current code. Localities can have a class 1 to 3 misdemeanor. So you can take grandma to jail. And Commonwealth's attorneys aren't going to do that. This changes it back to only a class 3, and trying to get folks into compliance is what we're trying to do in a meaningful way.
All right, any other questions for Delegate Hodges? Well, let me just see if anybody wants to. Anybody here who wants to speak to this bill, again, that passed the House 100-0? All right. Now, Senator Saslaw.
I move that we recommend reporting to the full committee.
Moved and seconded that we recommend reporting House Bill 769 as amended to the full committee. Would you call the roll?
Senator Saslaw.
Aye.
Senator Barker.
Aye.
Senator Donovan.
Aye.
Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Thank you, Delegate
Thank you, members of
Hodges.
the committee, Mr. Chairman. Y'all have a great day.
And Keith,
Next up.
Keith, did you want, oh, you just said thanks.
I was going to tell you, my county knows where my septic system is. So.
Well, thank you.
Next up is Delegate Scott.
He wouldn't BS you either.
How you doing?
Mr. Chairman.
What you got?
Thank you, Mr. Chairman, members of the committee. House Bill 1046 is just to direct Department of Medical Assistance Services to do a study on ways to save money. One thing that I've seen with my daughter, who has a lot of medical complications, is she was prescribed a certain type of formula because she's on a feeding tube. And $17 for that canister at Walmart, and DMAS is getting billed, or Medicaid is getting billed $97 a canister. We accidentally got a bill, and so we got to see that firsthand as to what that bill is. And so all this is doing is looking for a way for some of those over-the-counter things that might be prescribed by a physician, such as formula or other consumables, to be able to be put on a card that would be similar to like a WIC card or a SNAP card, a preloaded card, a certain amount already loaded for a monthly purchase. And if the family wants to go that route as opposed to ordering through a supply company, they have the ability to do that. And so, again, it's just a study bill to see if there is a tangible way that we can do this.
Okay. Simple enough. Any questions for Delegate Scott? Anybody in the audience want to speak on 1046? All right.
To recommend reporting.
Been moved. Senator
Second
Sewell,
again.
second. Been moved and properly seconded that we recommend to the committee reporting House Bill 1046. Would you please call the roll?
Senator Sasslaw?
Aye.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Bill 1
Ayes 5, no 0.
She's 2.5 years old, so a lot of medical complications, but she's a fighter, and I kind of beginning to expect she's going to live another 2.5 plus,
Yeah.
even though everything she has going against her. Thank you all for the
All right.
support of this bill. Thank you.
Delegate Head. Chris.
Heads and
What do we got?
outs.
House Bill 93.
Yeah.
And this is a fairly simple bill to just adjust the time frame for and length of licensure for home care organizations. It doesn't do anything to change the surveys and the oversight. It just simply changes it from a 1-year license to a 3-year license, and changes the fee from $500 a year to $1,500 every 3 years, so there's no fiscal impact on that. The only other change in the bill is it also does mandate that the department can't require a licensed home care organization to submit financial documents other than those required for initial licensure. And that stemmed out of a little problem that we had with someone that was requesting documents that literally could not be provided, and it hung up renewals for every home care organization in the Commonwealth last year. And just to say, look, if you've got your financial house in order, we'll look at that more in detail when we are surveying, but just for the renewal of the license, then don't ask for more documentation that you're not going to have time to look at anyway. And that's really all the bill does.
Any questions for Delegate Head?
House.
86 to 13.
86 to 13.
And that was my next question. What happened?
I have no idea
Yeah,
why
I
the
know.
13 decided that they didn't like that idea.
I don't know. All right. Anybody? We have a no. Oh, we have a no in the front row. All right. Anybody here to speak in favor of House Bill 93?
Yep. If just to say the association supports it would be nice, I think.
Yeah. Yeah. Everything helps.
If it's smooth sailing,
Well, you never know.
you never know, right? Marcy Tatterton with the Virginia Association for Home Care and Hospice. We support the bill.
Okay.
How about that?
Yeah, that's good. Anybody else to speak either for or against House Bill 93? I'm sorry.
Move to recommend reporting.
Moved.
I'll second it, even though I thought we were going to hear more delegates.
Moved and properly seconded that we recommend to the full committee reporting House Bill 93. Would you call the roll?
Senator Sasslaw?
Aye.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Aye.
Ayes 5, no 0.
Good enough. Thank you, Delegate Head.
Sharon, members of the committee.
Now we go on to the OROC docket.
Got a few, Mr. Chairman.
This says you have two. I thought I had three for
I've
you.
got four.
Four.
Yeah, keeps growing.
Maybe it's 2 times 2. All right,
Mr.
shoot.
Chairman,
What
may
do you want
House
to
Bill
start with?
234, please.
34, yes, sir.
And Mr. Chairman, just so things are in the proper order, I think, and I want to make sure I'm working from the correct version, I think we may need to amend the measure. According to my language, I think on line 15 of the bill, we've got after the word public, and to develop recommendations for consolidation of such oversight and regulation. Is that what yours says or no?
Yep, that is.
I would like to strike that language, please, putting a period after the word public and striking the rest of line 15 and the new language on 16. That's just to clean it up, Mr. Chairman.
Okay, I've got you. Okay. Is that the only amendment you've got?
Yes, sir.
All right, somebody want to move the amendment?
Move it.
Moved and seconded that we amend House Bill 234. All in favor? Aye. Opposed? All right, the bill as amended is in front of us.
And, Mr. Chairman, that was just to clean up, the original bill would have looked at consolidating. I don't want to do that. Right now, I just want to look at, the department looking at, are there ways to bring greater efficiency and transparency to our current oversight process in nursing homes, assisted living communities. This measure and another I have coming as a result of my experiences this past summer as I became the primary caregiver for one of my sisters, and when she broke her hip, go in some of these various facilities, it seemed to me we need to look at how we can make these facilities and the regulations they operate under more consumer-friendly.
Okay.
And so that's the purpose of the bill. It's just a Section 1 bill.
I think it'll come back with the language for consolidation in the future.
It's a third rail. I'm just letting you know.
All right, any questions of Delegate Orrock from the committee, subcommittee? No questions? Anybody here in the audience to speak in favor of House Bill 234? Anybody to speak against 234?
Move to recommend reporting.
It's been moved and seconded that we recommend to the full committee reporting House Bill 234 as amended. Would you please call the roll?
Senator Sasslaw?
Aye.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Aye.
Ayes 5, no 0.
Thank you, Mr. Chairman, members of the subcommittee. If I may, House Bill 235. This is also a result of my personal experiences where we found when she was being discharged from the rehab facility, under the current regs, they had to contact for her in-home PT and follow-up. But they didn't have to ensure that it was going to be secured. The rehab facility called somebody, and had I not been a proactive advocate on her part, she would have had no post-discharge rehab established. And this is just to look at how we can address that problem, because I completely understand on the one hand, when the rehab facility is discharged, they shouldn't have to keep chasing the rabbit, as it were. But we need to look at a means whereby we ensure these patients are going to have the necessary post-discharge care that they will need, and this is just to have the department look at that, Mr. Chairman, members.
All right, very simple concept. Anybody have any questions from the subcommittee on House Bill 235?
No, sir.
None? Anybody in the audience to speak in favor or against 235?
Move to recommend reporting.
Second.
Been moved and properly seconded that we recommend reporting to the full committee House Bill 235. Would you call the roll?
Senator Sasslaw?
Aye.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Aye.
Ayes 5, no 0.
Thank you, Mr. Chairman. Next, if we may, House Bill 910. Mr. Chairman, members of the subcommittee, currently hospitals are reporting their emergency room data as an aggregate. So if the facility has 2 or 3 freestanding EDs or a smaller hospital, all this will do is codify that they are still that same data now, they just have to separate it out so we can get a better handle on the severity codes that are going to the freestanding EDs versus the hospital versus smaller facilities. That's all the measure does. And in particular, as we're having the Joint Commission on Healthcare look at this going forward, I think this will be very valuable to let us see what part the freestanding EDs are playing in overusage of EDs, personally.
Any questions from the subcommittee for Delegate Orrock on this bill, 910? Anyone in the audience want to speak on 910? Anybody against 910?
Move to recommend reporting.
Moved and properly seconded that we recommend to the full committee reporting House Bill 910. Would you call the roll?
Senator Sasslaw? Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis? Ayes 5, no 0.
You're batting 1,000. Okay.
I'm going to push my luck, Mr. Chairman, and one more time. If
Yeah.
House Bill 919. And, Mr. Chairman, if I may, so things are in the proper posture, I'm going to request an amendment to that measure that was requested by the department, and that would be on line 55 of the legislation before you as it's being distributed. We just insert, formed by the Department of General Services, Division of Consolidated Lab Services, so we make clear what testing entity will be collecting these water samples and
Okay.
evaluating them.
All right, is there a motion on the amendment?
Move to
Move to adopt the
Agree.
amendment.
Adopt,
Okay.
yeah.
And Senator Suline, you second that, don't you? All right. It's been moved and properly seconded that we adopt the proposed amendment to House Bill 919. All in favor?
Aye.
Aye. Opposed? Okay. So the amended bill is in front of us, and
And Mr. Chairman, members
Go
of the
ahead.
subcommittee, this is just to make sure that as we're looking at our public water supply, and particularly as it relates to PFAs, that we, one, comply with any federal rules that are coming down. The previous administration kind of slowed that train down. The Biden administration has picked it back up, so we want to make sure we're going to comply. This will not stop the current regulatory process that our Virginia Department has begun, but it will, as they are, if they so choose, to establish an advisory work group, that it will let that work group run in parallel with the regs that are already going to be going forward potentially and can weigh in before they go to final approval. And you'll see a lot of enactment language there to make sure that all the stakeholders have the ability to weigh in. Delegate Guzman had a study bill, which most of that was incorporated in the enactment language you see here before you.
And so you mentioned, Delegate Orrock, that the new Biden administration has really made this, the EPA has made this a priority, I think. Is that correct?
Correct.
The new EPA administrator?
Yeah.
All right. Are there any other questions for Delegate Orrock on 919? Nobody? Okay. Anybody in the audience want to speak in favor of 919? Chris?
Yes, Mr. Chairman, good afternoon, members of the committee. Chris Pomeroy, I represent the Virginia Municipal Drinking Water Association. The group consists of most of the major publicly owned water suppliers. Thank you
Oh, that's
so
right.
much.
Yeah, they've got to pick you up on everything.
Thank you, Senator. Mr. Chairman. The group consists of most of the major public water suppliers that are owned by localities or independent water authorities across the Commonwealth. We really appreciate the concept in the bill for its effort to sync up the very substantial EPA. This is a list of the EPA activities underway on this specific chemical class. So we have major facilities from Northern Virginia all clear across the state that, depending on what levels are ultimately selected by the scientists to regulate the water supplies, either our existing facilities will be found to be doing the job. And by the way, thankfully, the levels that have been detected through the Health Department's December 2021 study report show that all the levels are well below EPA's currently recommended advisory levels. Now, EPA is continuing to study, and what we're looking to understand from a capital facility standpoint is that the federal regulations get synced up with the state process, and that we have a clear path forward for understanding what rules we'll have to live with in the future. So the bill pulls all that together, and we would appreciate support for it. So thank you for letting me speak.
Yep, Senator Sassler.
Would something like this have prevented a situation that occurred outside of Detroit last year, 2 years ago?
The type of, well, I would say no. That was such a fundamental, basic mistake that to anybody in the industry, it's so inexplicable, it should have never have happened.
Right, okay.
Thank you for asking him that question.
Any other questions? All right, thank you, Chris.
Thank you, Mr.
Next. Preston.
Good evening. Preston Bryan on behalf of Virginia Municipal League and Fairfax Water. Fairfax Water serves about 2 million Virginians drinking water. Fairfax Water doesn't take a whole lot of positions on a whole lot of bills. They're very keen on this one for its coordinating efforts between EPA and VDH, so they very strongly support this.
Okay.
Anyone else to speak in favor of the bill? Is there anyone here to speak against 919? Yeah, yes, sir.
Mr. Chairman, Bob Shippey with Sierra Club. We appreciate the intention of this bill, and it could be that it can be fixed. The way we read it, these work groups are not actually required to start, and if they don't start, we worry that the regs will never get written. Also, I don't think there's any budget allocation for the work group, so those are our objections to the bill.
I understand. Does VDH have money in its budget to absorb?
There is money in the House budget, but I was also told just this afternoon that with the normal regulatory process, they convene a stakeholder group on that, and that's just normal part of their APA process.
Okay. Okay. Are there any questions after? No?
Move to recommend reporting.
Wait a minute, let me see. Is there anybody else out there against? Okay, go ahead. I'm sorry, Senator Donovan.
Move to recommend reporting.
Second.
All right. It's been properly moved and seconded that we recommend to the full committee reporting 919. Could you call the roll?
Senator Sassler?
Aye.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Aye.
Ayes 5, no 0.
Thank you, Mr. Chairman, members of the subcommittee.
All right, thank you, Delegate Oric.
Mark.
Bobby?
Delegate Davis.
I've got House Bill 248. And
There you go.
I'll answer the last question first. It passed out of the House 100 to 0.
Yeah, we've got
so
it
that
on
may
our-
help.
we've got it on our sheet, so.
No one looked at it.
Sure, sure.
It's funny, we said the same thing in caucus about y'all's bills earlier today. House Bill 248 is a simple bill, Mr. Chairman. What it does is it takes information that's already collected today by the health insurance plans, puts the Department of Health in conjunction with the state the State Corporation Commission, the Bureau of Insurance, to provide more transparency in these numbers, and then put them on the website so consumers and businesses can actually see this as they make their decisions. Prior to that going on there and going live in July of 23, it also provides for a work group being put together that shall meet and give their results by November of 22, which will be put together by the Bureau of Insurance as well to make sure we have all the right information on there.
Okay, okay. Any questions for Delegate Davis from the subcommittee? All right, anybody in the audience to speak in favor of 248? Hey there.
Hello, Mr. Chair, members of the committee. Brent Rawlings, Virginia Hospital Healthcare Association. We support the legislation. When you look at information available to the state on healthcare providers already today, you see a lot of information available on hospitals, physicians, and others, but not much for insurers. And this just seeks to close that gap some more. We did work with Delegate Davis on this. We heard a number of concerns with the health plans. I think we've hopefully addressed those with the bill that's before you. What was introduced was far more comprehensive, and we really are looking forward to getting to work on this and improving transparency so that folks know how their health care premium dollars are being spent.
Okay.
Thank you.
Great. Mr. Gray.
We're still in support, right?
Is there peace in the town?
Not quite. Mr. Chairman and members of the committee, I'm Doug Gray on behalf of the Virginia Association of Health Plans. I don't disagree with the concept of having a dashboard. I think this bill could have been written a little bit better. I made some suggestions to improve it so we could get to peace in the valley, and none of them were adopted. The practical challenge here is this is really a study that puts the cart before the horse. It says you shall include, and that's everything from line 12 pretty much down to 30. And then it gets together a group to tell them how to do what they've already told them to do, and then add anything else they might like to add. I would suggest to you that if we want to do better dashboards at VHI for health plans and providers, that we should look at everybody. Nursing homes now have a value-based payment system that's going to affect now. Hospitals have some changes going on in their arrangements. I think we should look at everybody's and report back to you rather than put the cart before the horse and decide in advance. I would suggest to you that some of the things that are highlighted in here are not the things that a consumer is interested in. The consumer is interested in the network. They're interested in their rates. The employer in particular who are buying them. They don't ask what the MLR is. That's not what they're interested in. So I'm perfectly willing to work with folks on it, but I think at some point here we ought to be taking a little bit broader look.
Delegate Davis, do you have is there any fertile ground for compromise there on that?
Well, so we have. I know that Mr. Gray said we haven't made changes, but as you can see, this is a substitute. Had it not been for Mr. Gray, this would not say substitute on it right now. So we have made changes. I know that he's mentioned lines 10 through 8 or 12 through 18, but if you look at that actually tells that what will be provided on the website, not the actual metrics, but the fact that this will be maintained on the website. The data shall be collected. It's without
without lines 10 through 18, you don't need this bill at all. And clearly, on the backside of this study, 10 through 18 just says how it's going to be out there. Additionally, I understand that Mr. Gray says that no consumer would want to see any of this, but I beg to differ. I mean, line 24 alone, annual premium rate changes. I know as a consumer, I'd like to know what's going to happen next year on the trend line with my rate changes. But the consumer is also always the individual. Sometimes it's the business owner. And we've all seen our business premiums go up dramatically. And as a business owner myself, I know I'm very interested in the trend rate of these plans when I bring them into my company. So I think this will, and to the extent that Mr. Gray did get his way, and that is that the work group will start. It shall end before the deadline has to be for the website, which is July 1st of 23. I think this puts everything in the right order now.
All right, any questions for Delegate Davis in light of Mr. Gray's testimony? All right, Jeff?
Good afternoon, Mr. Chairman, members of the subcommittee. Jeff Palmer on behalf of AHIP. Really want to echo some of the comments of Mr. Gray that this does put the cart before the horse. No objections to a dashboard, no objections to transparency, no objections to a work group, but the second and third enactment clauses really predetermine the outcome of the work group. So there, it really does put the cart before the horse. So we would encourage a work group to focus on transparency, but I don't think we need to predetermine the outcome of that work group. So thank you.
Okay. Anybody to speak in favor of 248? Okay, you've got two who don't like it, one who
Oh, no,
do.
we had one. Yeah.
Right.
One who did, one who does. Yeah.
Mr. Chairman, do I have the right bill with enactment
Yeah.
clauses?
I don't have an
We don't-
enactment
we don't
clause.
have-
I was wondering myself.
Did he mean to say enactment clause, Jeff?
I'm sorry, section 2 and
Yeah,
3 of the bill.
right.
Oh, okay.
Okay, I was kind of curious myself.
I apologize.
So I don't know where everybody is on this, Delegate Davis. It passed the House 100-0. We've got some people who've raised some concerns here. What do you want to do?
Well, Mr. Chairman, I mean, I don't know what the argument is over the second paragraph. I mean, for me, the dates matter more than what paragraph comes first, right? And I know we all get tired of seeing studies that could happen and then nothing happens on the backside.
Right.
I'd rather not have the inefficiency and waste anyone's time by having a study than have to come back and say, okay, now should we do something with this information? So if we're going to study, let's get the information out there. And this says you do the work group first and then you put the information out. So I'd love for this body to move it forward, Mr. Chairman.
Okay. All right, anything else from the committee? All right, we operate by motion.
Move to recommend.
Can we hold this over for a week and see if we can't get...
I'm trying to nudge him in that direction, but he's not biting.
So my wife says I don't do well with federal either, Mr. Chairman. So
I'm going to move to hold it over for a week, and hopefully you can sit down with
Make it a little
Gray
better.
and Palmer and maybe
Yes, sir.
get things worked out that everybody's in agreement with.
And I'm not suggesting that's going to be determinative of the vote. I just think it's better.
Happy to give it another shot.
Better
Happy
process.
to.
Chairman, based on that, can I ask Mr. Gray and Mr. Palmer a question?
Yeah, sure.
So I just want to make sure I understand. You don't really object to you don't object to anything in here, just the order in which it's presented?
Well, no, Mr. Chairman, members of the subcommittee, to be clear, the health plans didn't have a role in drafting this legislation at all. This was drafted by the Hospital Association, and the substitute was drafted by the Hospital Association. It did not, we didn't see it before it was voted on in subcommittee and came out of subcommittee on a divided vote. So we, sections 1 and 4 of the bill, I think, are not objectionable. That's the work group and the goals of the work group. What is objectionable is sections 2 and 3 that predetermine what information will be useful in a dashboard that is supposed to provide transparency to the public for how to judge the efficiency and of health plans. But I don't want to speak for Mr. Gray.
Yep. Senator
I think there is a motion already to pass this by for the week.
Yes.
And I'm seeing a line get longer.
Oh, yeah, there's no need
And
to do that now.
there's only 5 of us, and I think that you all can come speak to us between now and then.
Yeah. So we're just going to try and make sure we get a better product. Again, I'm not trying to predetermine the result of any discussions that you all have. This bill, for all I know, in its current form, might sail out of here. But I'm just saying it's probably safer to, okay?
Happy to have a discussion.
Okay, good.
But probably won't.
Buy for the, and it might not. Buy for the week for $2.48.
Thank you.
Thank you, Delegate Davis. Delegate Price. All right, Delegate
Good
Price.
afternoon.
What you got? Oh, I see. Yeah,
800. So, Mr. Chairman and members, the bill is to codify the current practice whereby DMAS and DOC coordinate to enroll eligible incarcerated individuals into Medicaid. And while they're incarcerated, it allows for them to access the federally funded services. But then upon their release, the Medicaid coverage would still be in effect. And so for literally, it just, instead of it suspends the coverage instead of canceling the coverage so that it's easier for them to access the services they need upon release.
Pretty straightforward. Anybody on the subcommittee have any questions of Delegate Price?
I have one question.
Senator Donovan.
Listen, Jen, is it federal law that when they're in prison, they can't be on Medicaid?
Yeah, and in the federal services that are available, this is actually, I'm sorry if I missed it, this is current practice in Virginia. It's in our current budget language. This is just codifying it.
Okay. All right. Any other questions from subcommittee? Is there anybody in the audience to speak in favor of House Bill 800? Anybody speak against House Bill 800? All right, we operate by motion. This bill passed the House, 98 to 1.
I move it be reported. Report to the full, recommend reporting to the full committee.
Moved.
Second.
And seconded that we recommend reporting House Bill 800 to the full committee. Would you call the roll?
Senator Stazel?
Aye.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Senator Lucas.
I don't get it.
Are you Senator Locke?
I thought you looked like.
I apologize, Mr. Chair. Senator Lewis?
Yes, aye, aye.
Ayes 5, no
All right,
0.
Delegate Price, you're out of
It
here.
was worth it just for that.
All right, Delegate Helmer.
Nova does not want this bill, and neither does the hospital association. They said it's a stupid.
All right, Delegate Helmer.
Thank you, Mr. Chair. Thank you, members of the committee. In front of you is House Bill 481. 481 is pretty straightforward, actually. It asks that our hospitals here in Virginia provide a machine-readable price list of their prices, which they're already supposed to do. We're really fortunate that we have some great hospitals in Virginia that are already doing exactly what this bill asks them to do, which is put a machine-readable price list out on the web and a list of 300 shoppable services. It says this is a Carilion Roanoke Memorial Hospital. When you go to their website, you can find a list, machine-readable list of all their prices, and you can pull it. And if you want to make a tool that allows patients to compare prices from one hospital to another, you could look at their prices, and it causes competition.
Why do we need the bill?
Mr. Chair, that is a great question from the senator. This is what 90% of hospitals in Virginia are doing. They're about 90%, according to a study that was released last week by VHHA, but broad noncompliance is not VHHA, by patients' rights advocates, but the noncompliance by hospitals is a widely established issue. It was the chairs of the Committee of Energy and Commerce in Congress sent a letter to HHS a few months ago saying there's broad noncompliance. Health Affairs has said there's broad noncompliance. Patient rights advocates have said there's noncompliance. And I have shared with you a number of letters from folks ranging from the AFL-CIO to ALEC saying there's broad noncompliance with this issue, and that it's a very important issue because not getting price transparency prevents us from negotiating fair rates. To your question, to the senator's question, Mr. Chair, what I'd say, this is another example of a hospital in Virginia, and I'm not going to throw anybody under the bus here, but this is about 90% of it looks like. If you look at this, what this shows when you go to what's supposed to be a machine-readable file with a list of prices, it just shows an average price. That's like knowing what the average price of a car is or something before you try to buy it. You actually can't figure out what am I going to pay when I go and do this. It doesn't allow you to compare prices. We have another example here from another hospital where they don't actually make it machine readable. They refer to 100% of a price list that you can't actually get, and it prevents you from being able to compare prices. Bottom line is the reason you have such a broad array of supporters of this bill, ranging not just from patients' rights advocates to the ARP, to labor unions, to people who served in the Trump administration, to people who served in Democratic administrations, is that if you want to get control of the cost of health care for the people who ultimately pay for it, which is always employees and employers, then you need to know what health care costs.
Well, it's not. I called Fairfax Hospital, and they're opposed to it.
The
biggest, I think, hospital operation in our region.
Mr. Chair, I'd answer the senator that about I mentioned the health affairs study. 60% of large hospitals across the country, the largest hospitals, are non-compliant with this rule. In fact, the hospitals sued the federal government to prevent implementation of this rule because they don't want to do it, because what it actually has the opportunity to do is allow capitalism to flourish and have people compare prices and make decisions one way or the other. And so I understand why hospitals are opposed. They're opposed because this bill will force them to compete on prices. I run a business. I don't love to compete either. I wish there was no competition and my prices weren't transparent and that people had to buy what I sell. For shoppable services, those services which you schedule in advance, this allows employers and employees, businesses like mine, to know what the cost is going to be, employees to actually make a predetermined decision about it, and to be able to look at a series of set prices.
I called Fairfax Hospital and I asked them,
Senator Saslow,
how much so-and-so is, they're going to tell me, or they won't tell me, according to you.
Mr. Chair, there's a couple answers to the senator. One is they're supposed to give you an estimate when you call them in advance. I can share, I've got a lot of documentation here about why when they give you that estimate, they have a lot of reasons and ability within the law to increase what they think, what they're saying the price is. And a few reasons that they do that is it allows them to essentially avoid, it's about negotiation after the fact. So if their charges are too high or things like that, the fact that it came with an early estimate that was high actually.
But I don't hear from anybody, I've never heard from anybody that complains.
I want to hear from the Trump official in the audience.
Can I ask you this? How long have the federal transparency requirements been in place?
They've been in there since 2021, Mr. Chair. Maybe
not that long then, right? Okay.
And this bill, Mr. Chair, just on that point, this bill we've added into from the original thing. We've given an extra year for this to go into effect, a delayed.
And the only difference between your bill and the existing federal transparency requirements the elimination of the price estimator?
Mr. Chair, one clarification. It doesn't eliminate any hospital that chooses to use a price estimator, even under this bill, could use
the option just for compliance
purposes. For compliance purposes, it says, hey, you can't use a price estimator tool. And the reason from a compliance, the hospitals have come and said, hey, look, we think the price estimator tool is better. And there's nothing in here that if they believe that's the case and they want to use the price estimator tool, that's fine. The problem with the price estimator tool is it actually makes apples-to-apples comparisons between different facilities very, very difficult. It often requires you to give personal information. I'll give an example. I went onto a local hospital. I used TRICARE because I'm a member of the reserve. And when I was asked to do it, I asked, what's the number you're going to use? So I would have had to enter my Social Security number in just to get an estimate of what a price might be there. And that price may not be one of the things this bill does and the federal rule does is say, look, you got to give the discounted cash price, you got to give the other prices that you would have there. So maybe I would choose to put a discounted cash price over the out-of-pocket price on a high deductible plan. I can't see that with an estimator.
Any other questions for Delegate Helmer from the subcommittee? Anybody?
I don't know if Katie's on the phone. I know she has a rep here.
Dr. Donovan? Dr. Donovan. Senator Donovan? Senator Dr. Donovan.
I'm just trying to work my way through this, having, looked at frustration with how charges are reported to patients and allowables and other things. And standard charge, tell me about that definition on line 21.
Yeah, so regular rate established by the hospital for an item or service provided to a specific group of paying patients, including a gross charge. This is the key part. It's the gross charge, the payer-specific negotiated charge, the de-identified minimum, the identified maximum, and discounted cash. So that's what I was referring to before. And so that would be by what it looks like. Just to hand it over to you is something like this. So you have, this is the full list. So this is not the 300 shoppable services. This is the full list. And what that, an aggregator can actually go through that and say, hey, this is what everybody is paying. Every single plan, every single payer, it's the cash price, all that kind of stuff. That's where you can see things like, you'll see very interesting things just by looking at this compliant hospital where you have gross charges that are less than some of the negotiated charges. And so knowing that, presumably somebody would go back in the future and say, hey, I actually want to negotiate a lower charge.
And so I ask because, I would love, to find a way to really sort this out and do it. But, the hospitals are so wrapped in a coiled web of federal and even state legislation. But, to me, this is, I don't know that hospitals have standard prices for things because it has to be the allowable from the insurance, and there's just so many variations. And so I would love to have that, but I don't know if I see that you've got. Is this exactly the federal legislation? We're just reiterating it.
Mr. Chair, I'd answer the senator. I'll quote right from VHHA from the General Counsel Brent Rawlings in an email on January 23rd. Based on our reading, there is nothing in HB 481 that is not already required by federal regulations. So I'm happy to share that email. But what I would say,
So, something that happened on an earlier bill that I didn't really like the way it went, and I don't like this either, is I don't like the way that the different names are being invoked and people are being, we're hearing about what happened on the House side, and I think that it's not following the legislation as much as we would hope.
Yeah, I think hearing about that is somewhat instructive in the truncated time of subcommittee to find out if it passed 100 to nothing. But
well, I don't mean that. I mean the last one we heard about accusations of who got it drafted and who didn't, and then this one, I think it's important that the tone be rolled back a little bit.
Okay. Okay. Any other questions from the subcommittee? Senator Donovan, you done for right now?
Well, yeah, I just am trying to understand it because I don't.
Well, I think we'll hear from some folks that'll put some flesh on the bones.
How it gets fleshed out, yeah.
All right, anybody speak in favor of House Bill 481? How you doing?
How are you?
Good. Who are you and who you with?
My name is Ilaria Santangelo, and I'm the Director of Research at PatientRightsAdvocate.org. I helped create the recent Hospital Price Transparency Compliance Report, which found that only 14.3% of hospitals nationwide were fully complying with the federal price transparency rule, in effect now over a year. Virginia hospitals fared worse at 13%. Although hospital representatives testified that Virginia hospitals were largely complying, our report clearly indicates that they are not. Partial postings aren't sufficient, and by law, hospitals must post all prices clearly and completely by payer and plan, including cash prices. Only when consumers can compare actual prices and not estimates and see that an MRI can cost $300 or $3,000 can they make a good purchasing decision. Real price transparency would unleash competition, level out price variations, and lower healthcare costs for all patients, employers, unions, and workers. Please vote in favor of House Bill 481.
So what's your organization? Where is your organization? Where is it based?
So we're at Newton, Massachusetts,
okay,
outside of Boston.
What's the name of your organization?
PatientRightsAdvocate.org.
Patients Advocates Rights.
Patients Rights Advocate.
Patient singular rights plural advocate singular.org.
All right, Senator Donovan.
Thank you. I'm just confused. I thought you said we had 90% compliance in Virginia.
Mr. Chair, I'd answer the senator. I said we have almost 90% non-compliant. 87% are non-compliant. I was just rounding. I said almost 90% are non-compliant.
And when we talk about non-compliance, I understood from Delegate Helmer that the federal requirements went in just last year, right?
Mm-hmm.
Okay. All right.
But hospitals did sue, and they did get it delayed, so
Okay.
they had ample time.
Okay. All right. Anybody else? Any questions from the subcommittee? All right. Is there anyone else out Oh, I see you're lined up. Come ahead. You might have to step away and let these folks up.
Good afternoon, Senator
Uh-huh.
Lucas. I'm Natalie Snyder. I'm with AARP Virginia, and on behalf of our nearly million members, we're seeking better consumer protections for our members and other Virginians. So we support Delegate Helmer's bill, and we hope you'll vote in favor.
Thank you. Next.
Good evening, Mr. Chairman, members of the committee. Sarah Cariano with the Virginia Poverty Law Center. I won't belabor the point. We think transparency is good, and we hope you vote for this bill. Thank you.
Thank you.
Mr. Chair,
I believe I was promised a Trump official.
Anybody else out there to speak in favor of 481?
I do have one follow-up question.
Senator Donovan.
That the hospitals have to list the attributed costs by payer and plan?
Mr. Chair, I'd answer the senator that is correct.
So how is that different than getting it from your insurance company?
So, Mr. Chair, I'd answer the senator's two parts. It's different certainly for the businesses who pay for it to know what the prices that are being paid and variable. That was one of the purposes of the CMS rule, was to provide the spread of what are the real costs that are associated with it. So that's a huge portion of it. The other portion is if you're in a high deductible plan, knowing this gives you the option to understand what a discounted cash price is in there. So you may make a choice not to pay the large out-of-pocket deductible that you would pay if your insurer did it, but you can't know if you're just going through an estimator. You can't know what that option would be.
I'm so sorry. I'm really sorry, Mr. Chairman, but I have another.
Ahead. Sure.
I don't believe that I can offer a discounted cash price to an insured patient because of the contract I have with their insurance company. And so I would love, I'm legally not allowed to offer that patient the choice between their health plan or the discounted cash price. And so, but this is where the confusion is for me, because there is not a cost necessarily associated with healthcare. That would be wonderful if we had a cost. You're talking about charges and getting to the root that's a cost. This is the problem with our healthcare system, but I just want, if we do something like this, that it's going to be reliable. And I think that there's so many convoluted twists and turns in the way the marketplace of healthcare is done. I don't know that we can fix it by looking at the cash versus what the payer allows. But I'm willing to listen.
Let's hear from the folks who are against 481.
Good afternoon, Mr. Chairman. I'm sorry, this is going to be typically longer than my normal ditto.
Go ahead.
Mr. Chairman, members of the committee, Julie Dime with the Virginia Hospital and Healthcare Association. Hopefully I can clarify a few things here. Virginia hospitals and health system are committed to ensuring that Virginians can access high quality, safe, and affordable health care. And that goal, it is critical that patients make informed healthcare decisions with as much information and in the most convenient way possible. Hospitals work every day to ensure patients are appropriately cared for and fully understand the cost of the treatment they received. To be clear, we are not opposed to this legislation, but we are opposed to this legislation. We are not opposed to transparency, but because it duplicates existing federal requirements that already apply to all hospitals in Virginia. We're also opposed to 481 because it includes requirements that conflict with federal regulations. Federal hospital price transparency rules went into effect, as you all have noted here, on January 1, 2021, to require all hospitals to make available on their website a single machine readable digital file containing the standard charges for all items and services provided by the hospital. The federal regulations also gave hospitals two options to let consumers determine the potential out-of-pocket cost for common services. An interactive price estimator tool that CMS has approved and in fact says is an even better way to allow consumers to understand what they would potentially pay. Or a static spreadsheet listing 300 common services, which is updated annually. So those are the two ways that you can comply. 87% of our hospitals in Virginia are compliant with the use of the price estimator tool. So that's what to answer your question. 87% of the hospitals in Virginia use the price estimator tool to be in compliant with federal law. So Mr. Helmer his bill would not allow us to use that for state law. What we're saying is if you want to mirror federal law, you would allow for the price estimator tool to be utilized as it is on the federal level. When CMS finalized its regulations, it determined that information on shoppable services would be better presented and made more consumer-friendly through the use of the price estimator tool. It stated that online display of shoppable services that would return an immediate out-of-pocket price estimate is preferable to the static spreadsheet of standard charges, exactly what you were getting at. So all you would see is just a standard list of charges that mean absolutely nothing to you, because without the deductible information, without your health insurance information, you would not be able to determine what that would look like. You're right that always the health insurance company is going to be your best bet to determine what your expenses will be for any healthcare service. So you're exactly right about that. That's why, again, most of our hospitals, 87%, he says 87%, I would say 97% Virginians hospitals and majority of hospitals nationwide utilize the price estimator tool, which often provides information for more than 300 services. This bill goes in a different direction. Than the federal regulations, at least, creating conflicting standards between the federal and the state law, which is more restrictive, certainly, less consumer-friendly, and adds additional regulatory burdens on the hospitals. It also would apply to ambulatory surgery centers. The state bill would apply to ambulatory surgery centers, which does not happen on the federal level. That is not included with in the federal regulations. And lastly, let me touch on compliance, since that has been a big topic. The proponents are suggesting that a large number of Virginia hospitals are not compliant with the federal regulations. That is not consistent at all with our independent analysis and responses by our hospitals, who invested a tremendous amount of resources to ensure compliance with the federal law. The organization promoting, which is the patient rights advocates, they're promoting noncompliance. They reviewed 23 hospitals. They did not review all Virginia hospitals. They reviewed 23. Oftentimes, when they are speaking to a more national look, which I cannot account for what anybody except for Virginia does as far as the hospitals. If there are examples of noncompliance, the final rule provides CMS the authority to assess a monetary penalty after providing a warning notice to the hospital or after requesting a corrective action plan from the hospital. And to date, CMS has not issued any type of penalty to any of our members in Virginia. I just want one last thing about the spreadsheet. The proponents claim that the static spreadsheet of shoppable services is necessary to provide employers with information about prices. Those same services are also included in the machine-readable digital file of all charges, so could easily be retrieved from information that's already available. And Mr. Chairman, we have done over the last several years, we've worked on balanced billing. We have now, this year, you're looking at medical debt. And even just in this committee earlier, you looked at severity codes. We're not afraid of transparency. We are continuing to move in that direction. We've done that over the last several years. So it is not a matter of us not wanting to be transparent and want our patients to have what they need to have. Transparency, that's a buzzword.
Any questions from Ms. Dime?
I'm sorry, I have a question.
Senator Donovan, go ahead. No, this is your thing. Go ahead.
Price estimator tool numbers. What information does that give a person?
Sure. So I'm actually going to phone a friend and actually let one of our hospital members come. And I think, Mike, Mike's here. Mike could probably tell us a little bit more. Everybody may be a little bit different, but it's going to tell you what service you're going to be able to put in your information. In that service, it will produce an estimate of what it may cost you. Now, as you know, keeping in mind, if something goes wrong during a surgery, that price may go up. But that's not the intent, and it's not like you can say flat, this is going to be your cost. I mean, no, I don't think anybody would ever do that because there are always potentially complications.
So just a couple more questions for Ms. Dime.
You want to get clarity on
that? No, I'm in a minute I will.
All right, go ahead.
Okay, there you go.
Go ahead with your question.
How much their copay is?
It would include, it can get, sorry, Mr. Chairman, Senator Donovan, I believe that is information that can be provided so that we can get you a better estimate.
So Mr. Chairman.
Yep, Senator
So
Donovan.
a cost estimator would be a prior auth that would tell you what your, basically what your copayment would be based on your insurance coverage.
I'm going to
Not
make
your
sure, yep,
deductible.
okay, yep.
Okay,
Everybody
all
tell
right.
me yes. Make sure don't want to mislead.
Do you anywhere print your cash discounted price?
So I think you were talking about that, I did ask Brent about what you were saying, and you are right, that in some, we cannot offer, if an insurance, if you have a contract, we can't offer a cash price. But I do believe in some cases on the form, there are cash prices, but I'm going to
Right.
let Brent
Mr.
speak
Chair,
too.
Senator Donovan, the existing law provides a provision, Section B in the existing law already provides language about payment estimates. That would be an example where if a patient came in, scheduled procedure, wanted to know a good faith estimate of the services, that would be where we would provide that information printed out for them if they come and request it.
So they have to physically come, Mr. Chairman, they have to
so
physically come into the hospital to?
No. Phone
Okay.
calls, I mean, if you go to the page where this information is already existing, on the machine readable files, we did this exercise, we know recently, just Google pretty much any hospital or health system and add price transparency or price estimation. It pulls you to the financial assistance policy page. It has phone numbers. It has those machine readable files. It has a link to the price estimator tool. You click on it. You can select your insurance type. It'll list the most common plans. You click on that. You go through the motions, select the procedure that you're interested in, and it spits back based on the available information. What you can expect out of pocket payment and so forth.
I'll give you the last word. All right, Jill, you through?
Yes, sir. Yes.
Anybody else to speak against 481? Is that it? Okay. Delegate Helmer? And let me ask you a question real quick before you get
Yes, thank
started
you, Mr. Chair.
on your wrap-up. So where does this 87% Virginia noncompliance figure come from?
That is from patients' rights advocates. So they did a full, first of all, that's from their sample, so you could be outside the sample and
Right.
be compliant.
Okay.
What I was pulling was examples of ones that were in their sample, and there are some great, look, we have many great hospitals providing great care throughout Virginia. This is specifically about pricing and price transparency and around whether they publish their costs. And so that's where the 87% comes from. Is earlier this year they did a full review. They do a biannual review of the entire country every 6 months.
Okay.
And they looked at more than 20 hospitals here in Virginia. But the broader point about compliance, and that's why I pulled this out here, and this is from April of this year, this is a broadly agreed upon fact. So this is from the ranking member and the chair of the Senate Commerce and House Commerce Committees, saying that writing to the Secretary of HHS, saying that lack of compliance with this rule is an ongoing issue. And so that's, this is, I know there's a lot being said about it, but actually that's not truly in dispute around that, and that's why I was able to give you examples here. The last piece I would just say, Mr. Chair, on the price estimator tool is, again, from HHS about why I'd rather go to neutral sources whenever I can, but this is from October of 2021 from HHS, and they're saying, look, we're very concerned that a provider or facility may increase the good faith estimate without specificity to circumvent the ability of the uninsured individual to access the patient-provider dispute resolution process, resulting uninsured or self-pay individuals being charged higher prices. So, ultimately, like I said in this bill, there's nothing that prohibits use of a price estimator tool. You can, and if the hospitals believe, and I think many of them do, that this is a better tool for patients, they can continue to do that. There's nothing in this bill that would change that. What this does do is say, we're going to put in, here in Virginia, you're going to publish this full list of prices, which is the broader list, which they already have to answer the senator's question earlier. Like they're supposed to be doing this anyway, so this just gives us the ability to make sure they're doing it here in Virginia. And then more broadly, it's saying for the 300 shoppable services, you're going to have that list to make it easier to compare.
Well, I mean, they can use the price estimator, but it's just not going to put them in compliance with this. If this becomes law, it's not going to put them in compliance then. They're going to be out of compliance.
Mr. Chair, if they used it solely, they would not be in compliance. But they already have to, they already have to do the broadsheet, the thousands and thousands. They're already required to do that. So pulling your 300 most used services out is not they're already required to do the broader list of prices no matter what. So we're just saying, hey, can you pull the 300 out?
Well, but I really told him I'd give him the last word.
Which we do.
but-
Just
okay.
wanted to clarify that we actually do that, plus then we have the estimator tool.
All right, Senator Dunham, it looks like you had a question.
I'm sorry, I am befuddled on two things. Number one is, what is different about your bill and the federal law that is new? What is the difference?
Mr. Chair, the only difference is that in complying with the federal law, it says that you have to include a list of 300 of your shoppable services on your website. That's it.
So your
Which is in line with federal law. It just says the price estimator tool essentially would be separate. It doesn't count as compliance.
It's not an
bias.
option.
It's not an option for the compliance component. Yeah, you still, in both laws, you have to print all your prices, no matter what, in a machine-readable format.
So okay. So then that brings me to my follow-up question. If somebody who's insured can't get the cash price and they already print the prices, what benefit to the consumer does this reporting actually do?
Mr. Chair, I'd answer the senator that this is the whole discussion we're having about compliance right now. They're not doing it.
So that's a different bill. That's a bill that puts teeth in compliance. That's not a bill that complicates what we're asking them to comply with. And I'm all in favor of anything that can support assisting lowering the cost of healthcare and giving people options, but we've already said they can't choose that if they're insured. So, and they can get them if they're a cash paying patient. And so I'm trying to understand what the value is to the consumer for the additional, you might be building cost into healthcare because this is more compliance, and it's compliance where we get tangled. So this is why I'm befuddled. So that I'm really just kind of truth seeking here, but I don't see where the value is in the kind of responsibility that you're asking for. If we could find that, I would feel differently, but I'm struggling on that.
And the only other question I would have, again, going to the compliance issue, is, as I understood the hospital's testimony, there have been no financial penalties or no penalties imposed on anybody for noncompliance. I mean, why would that be if there's such rampant, if there's 87% of Virginia hospitals are noncompliant, why wouldn't somebody get a fine or penalty?
Mr. Chair, I'd answer you on that one, that the CMS has given some space for compliance, but the anticipation is that there will be. It's sort of a circular argument right now. As you said, they went into effect January 1st of 2021, and they've provided some space for that. So that, in fact, that was in the letter here. That's one of the things that they address.
All right, that's it. Bill's before us. All right, there's no motion.
Thank you, Mr. Chair.
Thank you, Delegate Helmer.
I got it, huh?
What happened?
You just say that the bill received no motion for any activity.
And present to the full committee.
Huh?
Yeah. And present that to the full committee.
Yeah. I gotta, I'm gonna leave my proxy with.
Yes, that's fine. Yes, it's okay.
All right, Delegate Hope. Sorry for, timing's everything, Delegate Hope.
Your people didn't sign you up, Delegate.
Yeah. You got two.
Chairman, I have two. I'll do House Bill 663. This is really a technical bill. Last year, we passed mandatory outpatient treatment, and this just reorganizes it. It clarifies the provisions and organizes it in a way that's easily understood of the different levels of mandatory outpatient treatment. It does have a delayed enactment of October 1st of 2022.
I'll see you
And that's the
upstairs.
bill, but it's strictly technical. It makes, we do have some more technical amendments on the
Okay.
technical bill. So
I'll move that.
All right, Senator Suderline moves and Senator Donovan seconds that we adopt the amendments. All in favor? Aye.
Aye.
We have the amended bill in front of us. Okay.
That's the bill.
Oh, you're done.
It's
Okay, okay.
It's a technical bill, just
Technical amendments,
reorganizes
okay.
it.
All right, anybody want to speak in favor of 663?
I got a question.
All right, Senator Suderline.
I think I might have been trying to read it.
You may have already answered it, but why is it October 1? We don't usually start that date.
That was, I think that was a request from the Supreme Court to make that change, and I'm very accommodating, Senator. I don't know if there's anyone here from the Supreme Court. They had made that the request so that they can get organized in their training of judges of mandatory outpatient treatment, and so we gave them that extra time. It was their fiscal year.
All right. Any other questions of Delegate Hope? Anybody speak in favor of 663 or against 663? Typically, I would reference the fact that it passed the House 99-0, but after that last bill, I'm not going to do that anymore. So, all right, bill's in front of us.
I move to report the amended, or recommend report of the amended bill.
Yeah. Moved and seconded, properly seconded, that we recommend to the full committee reporting House Bill number 663 as amended. Would you call the roll?
Senator Sazzle?
Aye by proxy.
Senator Barker?
Aye.
Senator Donovan?
Aye.
Senator Suderline?
Yes.
Senator Lewis?
Aye.
Ayes 5, no 0.
All right,
All right,
Delegate Hope.
Mr. Chairman, last but not least, House Bill 669. This is now a Section 1 bill that directs the Virginia Department of Health to convene a work group to make recommendations on expanding their oversight authority on swimming pools for public use. Right now, they have authority over swimming pools in hotels, tourist destinations, and spas. This just brings a work group together to see if there's we can reach some consensus on all the different public pools that are remaining and what regulations those ought to cover.
All right. Any questions of Delegate Hope on 669? Anybody in the audience to speak in favor or against 669? Yes, sir. Come on up.
Good evening, Mr. Chair, members of the committee. My name is Jason Davidson. I'm the Director of Government Relations for the Pool and Hot Tub Alliance. We're based here in Virginia, and many of us work here in Virginia. This is a very simple bill that we had asked the delegate to sponsor, because currently the Department of Health does not have authority over public pools in Virginia except for summer camps, campgrounds, and hotels. So you're talking senior centers, rec centers, YMCAs. All we wanted to do was have a work group to talk about it, see what kind of recommendations we could put forth, if it's even necessary. We're one of the leading experts. In addition to that, there would be other stakeholders involved. We just want to have a conversation and put forth our recommendations to this body once we issue our report. We think this is common sense. This is about safety. So I'm happy to answer any questions.
Senator Donovan.
Mr. Chairman, and thank you so much. I'm so sorry I forgot your name.
Jason Davidson.
Thank you, Mr. Chairman, Mr. Davidson. Is there a problem that we're seeking to fix?
Well, first of all, this bill doesn't seek anything to fix. It's just having a conversation, number one. Number two, there is a problem. Only 20 jurisdictions in the state have a swimming pool code. All the other jurisdictions do not. They don't have an operations or maintenance code for swimming pools. This doesn't touch new construction of pools, only operations and maintenance. So in light of that, I believe the department should have some sort of oversight. For example, there was a drowning in Pulaski County last summer at a YMCA. The Department of Health didn't even have the authorization to go in and just investigate what happened. Lifeguard shortages, what could have caused that? So we just want to have a conversation. And the recommendations, as you saw in the bill that was drafted previously until it was amended, it did not affect local authority. If a local authority had a code, it doesn't get touched. This is for those that don't have a code.
Mr. Chairman?
Yep, Senator Donovan.
How many other states have this? I mean, obviously, you were having a work group to seek regulations or legislation in the future. You've just spoken to that. You want to have some sort of central oversight. How many other states do?
Most health departments in the country do have oversight. Virginia is one of the few. And I apologize, off the top of my head, I can't remember. But I'm from Maryland, for example. The health department has oversight of all public pools.
Mr. Chairman, Maryland would not be my role model.
Maryland does not require inspection of motor vehicles.
Yeah. All right, I see somebody else lined up out there.
Oh, I was just going to jump in and answer the question.
Oh, yeah, well, we like answers to questions. What is it?
Mr. Chair, I'm Olivia McCormick. I'm with the Virginia Department of Health. I would answer the senator. Most states do have this authority in their state Department of Health. We've surveyed states east of the Mississippi. Of the 26, Virginia only joins 3 others where we could not find a central pool.
It's one of 3.
Mr. Chairman?
Okay, Senator Donovan.
Again, for more government, more infrastructure, more regulations, more fines that are associated with those things, what is the health problem you are seeking to solve?
Well, I mean, I would tell you the things that they regulate, and she could speak directly to what they regulate, but the things in terms of safety, water treatment, maintenance, safety features like signage, staffing of a pool, things like that, those go directly to making sure that the pool is safe. And I think most people, Senator, respectfully, when they go to a public pool, they assume that there are regulations. And probably in some areas, in my neck of the woods, the locality steps in, but that's not the case in all. This bill doesn't even make any presupposition to that. This just brings a work group together to bring all stakeholders together to see what's feasible in terms of having VDH have their regulations come under their jurisdiction. That's all, nothing more.
Mr. Chairman, I would propose it's a bill seeking a problem. If we haven't had any problems, I just, it's just my opinion. I think, a minimalist approach is superior unless there's a problem.
Go ahead.
Mr. Chair, if I can, some examples of what the Virginia Department of Health cannot currently do to public school pools. Water clarity affecting the ability to see swimmers in distress underwater, response to fecal incidents in the water, life-saving equipment, reaching pole to assist with drowning in progress, or the general sanitation or cleanliness of facilities, algae, broken glass. Those are problems that are in pools today, and that's what it seeks to solve.
I don't, Senator Dunn, I don't like bills looking for problems either, but I think Delegate Hope's right. I think most people are under the assumption that the pool they're in is being regulated by somebody or checked by somebody for health issues. And I've taken my son to a pool a few years ago that I wondered what was going on there. So, yeah, I understand what he's trying to get at. All right. Anybody else? All right. Bill's in front of us.
Move to report.
And Senator Sasslaw seconds.
Yeah, Senator Sasslaw.
Okay. All right. All right. Been moved and properly seconded that did we amend this thing? We did not, did we?
No.
All right. Been moved and properly seconded that we recommended the full committee reporting House Bill 669. Could you call the roll?
Senator Sasslaw?
Aye by proxy.
Senator Barker?
Aye.
Senator Donovan?
No.
Senator Suderline?
No.
Senator Lewis?
Aye.
Ayes 3, noes 2.
All right. Thank you, Delegate Hope.
Thank you.
All right. That's it, folks.